Experimental, clinical, and epidemiological evidence strongly suggests that genital human papillomaviruses, HPVs, are predominantly sexually transmitted. As with any other sexually transmitted disease, STD, men play a role in the epidemiological chain of the infection. So how do men contribute to the spread of cervical cancer? Men who have sexual contacts with women who have multiple sex partners or do sex work have a higher chance of spreading HPV. Acting both as carriers and vectors of oncogenic HPVs, male partners may markedly contribute to the risk of developing cervical cancer in their female partners.
The more multiple partner somebody has, the more risk you are. So naturally, if you have less sexual partners, then you're already preventing cervical cancer.
Thus, in the absence of screening programs, a woman's risk of cervical cancer may depend less on her own sexual behavior than on that of her husband or other male partners. Although more rarely than women, men may also become the victims of their own HPV infections, as a fraction of infected men are at an increased risk of developing penile and anal cancers.
Yes, you can test men for HPV. Because it also causes penile cancer, penis cancer.
Oh, okay.
Yes, the same HPV causes penile cancer, but is not as aggressive as it is in the cervix. So penile cancer, there is just the prevalence of penile cancer compared to cervical cancer. Cervical cancer is up and penile cancer is down. So it's a way that the penis is resistant, while the men just carry it on.
They just carry
it. Few people will contract the penile cancer.
How can men then reduce the spread of HPV? Condoms are one sure way that can reduce the spread of HPV in both partners that men should embrace and incorporate in their sexual lifestyle.
The simple thing, the men are the one giving the women human papillomavirus, so they should reduce the number of women they sleep with, or they should put on a condom if they're sleeping with other women. Condoms is known to prevent human papillomavirus from getting to the cervix, so that would be a way to prevent it.
Male circumcision too has been shown to reduce the risk not only of acquiring and transmitting genital HPVs but also of cervical cancer in their female partners.
If your wife had died of cancer, then the next partner you're going to have, you're increasing the chance of death of that woman from cervical cancer. So it's having some responsibility, in order to safeguard, the life of the other people.